hello everyone, and welcome to our Great Plains Quinn Friday Focus for Health Pathways to Safer Opioid Use. This Friday Focus for Health is hosted by the Great Plains Quality Innovation Network, the Centers for Medicare and Medicaid Services, Quality Innovation Network, Quality Improvement Organizations for North Dakota and South Dakota. That's a mouthful. My name is Stephanie Hansen. I am a registered nurse and quality improvement advisor for the Great Plains Quinn. I'd like to introduce Tammy Wagner and Jennifer Lochner. They are part of this team. And a shout out to Carrie McDermott with our communications team. I want to thank you all for joining us today. Today's webinar is being recorded and will be posted within 1 to 2 business days on our website at greatplainsquinn.org under Friday Focus for Health link that we will also share with you. If you have questions, please add them to the chat. We have added a resource handout that you can access. This resource handout includes all resources shared during today's session and will be added to as the 4-week series occurs. So to get started, more than 100,000 Americans died from drug overdose between May 2020 and April 2021, the most ever recorded in a single year, according to the Centers for Disease Control and Prevention. Without bold and urgent action, an additional 1.2 million people in North America will die 29. This is why this issue really does need to be addressed. In our 4-week action group, we will learn more about opioid misuse and opioid adverse drug events. Today, being week 2, is how to work with pharmacists in the opioid efforts. Week 3, we will talk about how physicians and nurses impact opioids. And then week 4, how to work with patients and families and how to teach back in interactions with them. Next slide, please. Today, we will be speaking with Josh Ortman. Josh is a clinical services pharmacist and pharmacy consultant for the Medicine Shop in Rapid City, South Dakota. He serves as a network director for the South Dakota Community Pharmacy Enhanced Services Network and has united community pharmacies across South Dakota. He is also involved in several projects and serves on an antibiotic stewardship lead for the South Dakota Foundation of Medical Care. As we know, pharmacists are an essential part of the healthcare team on the front lines of dispensing opioid pain medications and providing medication-related services. Pharmacists can serve as a first line of defense by engaging in prevention and treatment efforts of opioid use disorder. Thank you, Josh, so much for being with us today and for being the voice for pharmacists in this opioid crisis.
Thank you for the invitation.
Yes. Josh, I would like to just start out, let's see. Sorry, I would like to go ahead and ask a few questions. Again, at any time, add comments in chat and we will have an open discussion at the end. First of all, Josh, what would you say is the pharmacist's biggest role in preventing opioid misuse?
Yeah, so I think, Stephanie, kind of as you described, pharmacists really serve a couple different functions in preventing opioid misuse. First and foremost, in addition to being medication experts and understanding how prescription medications and opioid medications interact, we're also very well familiar with the laws surrounding opioid use, prescriptions, quantities, days supply, and those types of things. And we know that our laws, both federal and state laws, are really that first step in patient safety and patient protection. And so by following the laws, we're taking the first step towards preventing opioid misuse. And then I would say the second step that pharmacists really can offer is we have access to the prescription drug monitoring program, and that is a database that will show each patient's prescription, particularly controlled substance prescriptions and those that have been dispensed in the last year, 2 years, 3 years. So pharmacists really have the opportunity to take a global picture of what that patient may be using for medications. And then, of course, with our medication expertise, that third step in preventing opioid misuse is just to ensure that the patient's appropriately using their opioid prescription. We're looking for interactions with other medications. Are there potential risks of breathing emergency or overdose risks for patients based on their other prescriptions? So there's many different ways that pharmacists are involved, and but it's really a compilation of steps, Stephanie, that we work with.
Yeah. No, that's great. I guess that would lead me into like, Josh, what do you think then are some of the barriers to fight the opioid crisis as a pharmacist?
I think that the opioid crisis, I think, traditionally had been focused around prescription opioid medications. We know that there was a high volume of prescription use. Opioids were prescribed much more freely in previous years, even as far as a decade ago. And what we're seeing now is kind of the after effects of that high dispensing rate. And that combined with the influx of illegally obtained fentanyl, I think we're really, really looking at that fentanyl influx combined with previous opioid products is definitely a challenge that we're all facing. And one of the barriers that I see as a practicing pharmacist is that oftentimes a patient may go to their physician or urgent care clinic or whoever that physician may be, and they may come into the pharmacy expecting a prescription pain medication. And after reviewing the patient's prescription drug profile, we see that maybe a different physician, maybe their primary care physician, has prescribed a similar agent. And so really one barrier that we have at the front line of this is, as pharmacists, is we often are in a situation where we're tracking down information, contacting physicians to find out really what the safest and really the most effective treatment will be for that patient. So that's definitely one of the barriers that we face.
Yeah, and I can only imagine that is a lot, very time consuming, too, when you have to trail that.
Yeah, and the other thing too is that there's, patients have an expectation, and we want to be timely, and we want to provide effective therapy when we can. And sometimes that delay in care can put the patients experiencing pain. We certainly want to get them their medication, but we also want to make sure that we're doing it safely.
Yeah, yeah. I guess that would lead me to the next question. What would be your recommendations to all healthcare providers as to how we can work together to overcome this opioid crisis?
Yeah, that is really an important point, Stephanie, and I'm glad you brought that up as a question. Sorry about that. I am working in the pharmacy also, so
That's
so
okay.
I think opioid use and medication use, we look at just like any other condition, at pain, treatment of pain, and really we are a healthcare team, right? Everyone from the person at the administrative desk at input answering phones, all the way down to the physician prescribing, pharmacy dispensing. We really are part of a continuation as a healthcare team. And as for any condition, communication is really the key to success. And regardless of our individual views on substance use disorder, it is important that we view that as a medical condition, and that putting our patients' safety and care first is the top priority. I think another recommendation for healthcare providers is to remain diligent. We do want to respect and treat every patient as best as possible, but we also need to be aware of substance use disorders and make sure that we're aware of that and can get the patients the care that they need. And then I do just want to put in one plug is, there are safe medication disposal sites all around, whether it be at a local pharmacy, through their county police department. And so I do want to encourage healthcare providers that as you're coming into contact with patients, to just remind them to use those safe disposal things, because we do know that the presence of opioid medications, in particular after a condition may have resolved, is a predisposing risk factor for development of substance use disorder. So use those disposal sites. They are free and very available. And finally, remember to use the PDMP on every prescription if they have that available. If they don't, every pharmacy can have access to that. So please, if you're not sure if a patient has had medication, or if you're unsure about interactions, please contact the patient's pharmacist. They'd be more than happy to take a look at that monitoring program for their patients.
Okay, that sounds great. And I think Carrie shared a link there too on that PDMP that you can use. So thanks for that too, Carrie. I also know, Josh, we do have a lot of nursing home staff on this call. So I'd like to direct this question for them. How do you think the nursing homes can work with their pharmacist, consultant to reduce the opioid adverse events?
So at the medicine shop in Rapid City, we also provide service to many of the nursing and assisted living facilities in the area. So this is definitely a topic we're familiar with, and an important one, because that is a population that we may not always think of as in our opioid crisis, but it is certainly a worthy discussion point. So thank you for bringing that up, Stephanie. I think what I recommend, and as far as nursing home staff and facility staff working with a pharmacist or consultant pharmacist, is that consultant pharmacist is more than capable or willing to provide education to all staff members on Narcan administration, when to use it, how to use it, what to expect after use. And I think Narcan administration can be an important adverse event reduction point for a facility. So that's one way. A second way that I like to encourage nursing home staff, is use the pharmacist for verification of dosing of agents. You know, one thing that we see a lot is concentrated morphine. That product comes in a couple different strengths and concentrations. So one consultant pharmacist that I visited with, he recommended that in order in a nursing facility be input as both a milligrams and milliliters per dose. So for example, liquid morphine can come as both a 20 milligram per 5 milliliter strength, but also 20 milligram per 1 milliliter strength. A substantial difference in concentration there. And so by inputting the dose as both a milligram and milliliter, it's just a second checkpoint in order for patient safety and reducing that risk of a breathing emergency for patients. One other area where we see a lot of challenge in the nursing home is with dental prescriptions. You know, in some cases, dentists will write a prescription for, you know, maybe the patient has a tooth removal, and the prescriptions for Norco PRN, and it may not necessarily have a stop order. And where that comes into risk is without that stop order, the prescription's essentially active. And so now you have created a situation for potential patient misuse, and staff diversion can become an issue too, as that medication's hanging around. So that's another way that nursing home staff can work with pharmacy consultants. I always like to just, anytime I can, remind folks to be diligent in records on both e-boxes if your facility has those, maintain adequate logs. And another point that I would like to bring up is if a patient's or resident's condition is no longer an issue for that patient, let's get the prescription discontinued and make sure that agent is destroyed. You know, we see a lot of times where maybe a patient received a prescription for 1 to 2 tablets every 4 to 6 hours as needed for back pain, and the back pain's resolved, but all of a sudden the patient, they may have knee pain, and so now they're taking that without being, adequately assessed, and that prescription really may no longer be appropriate for the patient, especially considering medication changes and patient history. So, make sure orders match conditions and prescriptions are stopped if they are really not essential.
Oh, that is a great point to make. Being a nurse, that is huge to really think about and be sure we are catching that. So I appreciate that information. And I think the other thing, just being a nurse, I think we do have a tendency to underuse our pharmacists. I mean, they are available. They are a great resource and checking on dosing and different things. So again, I think just in the nursing home or in clinics or the hospital settings, just I think really reaching out to your pharmacist. They are, have great knowledge.
Yeah,
So,
and Stephanie, I think I would just add to that is probably most nursing home staff are familiar with that pharmacist consultant who, depending on how your facility works, they may come in once a month. You might only see that person very, very infrequently. They may be on the floor just one day or 1 day a week. But I do want to just let folks know that that pharmacist consultant is also over looking for things like, is this prescription appropriate, is there a condition that matches what this is for? So by you as a nursing staff bringing that up to the consultant, it's really a way to close that care loop. They're looking for that too, and it is actually really beneficial. I think you would find most pharmacist consultants would be really happy to hear if a nurse identifies something like that's putting the patient at risk, because they're looking for that too. So I think it's definitely a team effort.
yeah. Yeah, I was just going to say that teamwork together and communication is key. So I appreciate all of that information, Josh. I do have another final question. How do you overall assess for patients with opioid use disorder? And if you suspect this, what measures do you take?
Sure. That is a bit of a tough question, because I think opioid use and opioid use disorder has really been kind of a pendulum type thing. I think, 15 years ago, opioids were used for so many different ailments, and, maybe that wasn't exactly appropriate. But we want to make sure that that pendulum doesn't swing the other direction, and that we're not providing care to our patients that do legitimately need that medication. And so we do have concerns about abuse, but we also have to balance that with adequately treating our patients, because we know that's what we are all want to do. And so there's many different steps that a physician can take to reduce the risk of that opioid use disorder. Prescriptions for as short a duration as possible, double checking that prescription drug monitoring program. Uh, I've had physicians call and ask about the patient's other medications, and if non-steroidal anti-inflammatories are appropriate, or if Tylenol is appropriate. There's different ways of using non-opioid pain medications that sometimes can be considered, and if used properly, quite effective, if that's appropriate for the patient's condition. As a pharmacist, if a patient's suspected of opioid use disorder, there's a couple different routes we can go. We can certainly bring that up with the patient's primary care physician or with the prescribing physician. That unfortunately the typical community or retail pharmacy setup may not always, just due to the workflow, may not always lend itself to that confidential and frank discussion on, are you having issues? Is there something we can help with? And so that can sometimes be challenging. Of course, we overcome that as best as possible. And I think one of the other challenges that, pharmacists might face in a retail setting or a community pharmacy setting is that pharmacists are often, still viewed by the general public as medication dispensers, and maybe not necessarily as a healthcare provider in terms of all of the different things that we can know and can help with. And so I feel like every chance I can, I like to really just remind folks that, pharmacists are clinically trained. We are problem solvers, and with the medication expertise, and really we have a lot of patient contact, and so we are absolutely capable of helping a patient if opioid use disorder may be present. And a lot of that comes from just observation, watching patients with early requests, the vacation every month, going to tropical location. And then I just, finally want to just wrap up with, I really want to stress the importance of Narcan as a reversal agent. Community pharmacists are the points of dispensing for that. And we know that, that statistic, Stephanie, that you opened up with, 100,000 deaths in less than a year, or maybe a year, with the influx of fentanyl, we're seeing that rate skyrocket. And fentanyl is extremely, it's potent, it's fast on. Your window of time for an overdose or breathing emergency is limited. And so that availability of Narcan is something that I just want to emphasize. I don't think I can emphasize that enough right now. And so, yeah.
And I appreciate you bringing that up. And in our March Friday Focus for Health, we are going to do some training on that and have some really great resources and knowledge on Narcan, because that is a huge piece. And so, yeah, please join us in March for more to come on Narcan, for sure. So I guess that we do have several resources that we will maybe have been adding in chat, or can add in chat for you. And you can see the one tool resource there that we had shown. And then I just want to kind of leave you an action with you, that you can go to our website and find our quality improvement guide and tools. Just a reminder to build your team. Look at goals you have, define the problem, and then come up with a plan, and then to analyze your data. Next slide, please. So now we'd really like to open it up for questions. So please feel free to place in chat, or do come off mute and ask any question that you might have. So we will leave that open here.
Stephanie, do you want to launch the poll about the prescription monitoring drug program?
Yes, because we do have a question on that too. So I would love to have that be that polling question added. And I don't want to prevent anybody else from adding something in chat, or jumping
Tammy, I launched it. Hopefully that's okay. Hopefully you're seeing on your screen whether or not you currently utilize the PDMP, yes, no, or unsure. If you can provide your responses, that's helpful for us as we go forward in this Friday Focus for Health series to better understand where you're at.
Great, thank you. We're not seeing any questions yet in chat, are we?
Let me see.
I do have one for Josh also that does relate to the PDMP. I guess I was kind of wondering, Josh, your perspective on what, you think the utilization of the PDMP is. It'll be interesting to see our polling response, but also, do you feel like it's pretty much standard practice to use the PDMP, or it's, could be utilized more, or what are your thoughts with your practice?
Yeah, that's a good question, and definitely one that I'll let folks know. As a pharmacist, practicing pharmacist, 2 or 3 years ago, it was very difficult, or I should say not very, it was more difficult to use the PDMP. Required an external login, and the system was maybe not as user-friendly. Now, most pharmacies that you go to, they have the PDMP integrated right into their prescription software. So it is literally just a click of a button and linking. Of course, you would need an account, but that's not a difficult thing to obtain, and absolutely a very worthwhile and I consider it an essential component of providing, truly providing excellent patient care. As far as you, Stephanie,
Yeah.
I do believe that for most of prescriptions, we're going to see that used in a traditional retail pharmacy pretty regularly, just due to that ease of access. And where I would really encourage folks to use it is prior to the prescription being written, and because it's much more difficult to stop that prescription and then work back up the chain, as opposed to just right at the point of writing that prescription. If a physician can get that and alter therapy that way.
Okay.
And Josh,
Yeah.
we did get a question. Is it free to get an account to access the PDMP?
Yeah, yes, it is. Yeah.
And then is there a way to track PDMP usage?
Yes, that is. I'm not sure. I think it is. I'm not sure the governing body for the South
Yeah.
Dakota Prescription Drug Monitoring Program, but I know that it is monitored. So yes.
This is Lisa from Great Plains Quinn, and I also do some work for North Dakota Health Information Network. And I will answer for North Dakota, and I know that you can get an account for free to the PDMP, but you have to be a prescribing provider, and you can designate somebody to access that for you. And so from a nursing home perspective, where you might not have a primary care provider on site all the time, perhaps they could get that designated status and work in conjunction with their primary care provider. And then the PDMP is embedded into NDHIN. I shouldn't say that. It's integrated. So primary care providers can view the PDMP from NDHIN as well. So it's very accessible in North Dakota. And I know on the North Dakota Pharmacy website, there are reports that can be ran as well.
Oh, thank you, Lisa. That is just great information. I appreciate you jumping on to share that. And I know, I knew the time would go fast because there's so much great information. So I hate to end this. I did see the poll, and it does look, about 50% do currently use the PDMP, which is great, but 43%, that's kind of concerning too, that don't. So hopefully we can move forward with that and have more of that information coming up on more of our Friday Focus for Health. So we do need to jump off because there's another one to get on to for those that have registered. So I just really want to thank everybody so much for attending today. Josh, I really want to thank you for your expertise and knowledge and your time. And so if you are registered for the Friday Focus for Health, immediately following this one, you will leave this meeting and use the Teams link in your calendar invite. So in conclusion, just, please complete the evaluation. There's a QR code, or you can just go to the evaluation form to complete that at the end. And we thank you again so much for joining us today, and I hope you all enjoy your beautiful day.
Thank you.
Great. Thank you, everybody.
Bye.